We now know that untreated vision and hearing loss can increase risk for dementia. And also later in life, social isolation. We tend to sometimes, as we get older, we may find that our sphere, our number of friends begins to decline for a variety of reasons. And we can have a tendency as we get older to not go out and look for new friendships, and to spend more time alone. And oftentimes we're not in a situation where we're working. And so replacing those natural ways that we've had relationships um, seems to, according to the data, have a big impact in the overall health of our brain. So in 2024, the Lancet Commission on Dementia put out these 14 modifiable risk factors for people to pay attention to. And then just a few weeks ago, the Alzheimer's Association, in their international conference that took place in Toronto, Canada, shared the results of a major study called the Pointer Study. And the Pointer Study, like the Lancet study, was looking at the overall contribution of lifestyle to one's brain health.
Alzheimer's disease and other dementias are right at there at the top of our common fears about aging. And today they affect more than 55 million people around the world. That number is expected to more than double in the years ahead. And for a long time, these conditions were seen as unavoidable, with little hope for prevention or even meaningful care. But in recent years, that's been changing. Research is uncovering more about how lifestyle factors like exercise, diet, and social connection can influence brain health. At the same time, we're gaining a deeper understanding of what patients, families, and caregivers need to navigate the challenges of dementia with compassion and dignity and effectively for their health. The Mayo Clinic has just released a new edition of its book, Mayo Clinic on Alzheimer's disease and other dementias. It blends the latest science with practical, human centered advice. One of its authors, dementia care expert Angela Lunde, is my guest today on Optimal Aging, the show for fitness, health, and well being professionals who want to reach more people over 50. Now, I'll be talking soon with her co author, Dr. Jonathan Graff Radford, a Mayo Clinic neurologist. But today, Angela and I discuss what's new in dementia research, how caregiving is evolving, and why prevention and lifestyle are now at the center of the conversation. What does that mean for you in the fitness, health, and well-being industry? A lot. I'm Jay Croft of Prime Fit Content. I'm glad you're here. Let's dive in. Angela Lunde, hello. Nice to see you today.
Yeah, nice to see you and be with you, Jay.
Well, I'm really honored and jazzed that you're here with me because to have this new book that you all have put together on Alzheimer's and other dementias is extremely interesting to me and to the folks listening to this show because of all the really exciting advancements that are being made in how we're learning that our lifestyle choices and our habits, including exercise, can play a role in our brain health.
Mm-hmm.
So before we get into all of that, please tell me a little bit about yourself and your role at the Mayo Clinic, and then a little bit about the book and
Sure.
what's happening with that.
Yeah, happy to. So, yeah, I've been with the Mayo Clinic here in Rochester, Minnesota, and specifically with the Alzheimer's Disease Research Center now for the past couple of decades. I think I'm 24 years-ish. Um,
Okay.
and my role is I do some research in the area of caregiving. I've also have found myself as a strong advocate for persons living and impacted by different causes of dementia. The most, I think, common cause and the one that people think about oftentimes when they hear the word dementia is Alzheimer's disease. And I think when we hear the word Alzheimer's disease, we get pictures and ideas and images in our mind, so oftentimes of older adults, sometimes individuals who can no longer do things or have disabilities or deficits. And it can really paint, I think, a message of despair. And I share that up front when you asked me to introduce myself, because one of the things that I've had the privilege of over the past 2 decades is to truly be mentored and taught, not necessarily by my medical colleagues and professionals who are brilliant and who have taught me a lot. But I think what's most relevant and has been most impactful to me is just how much I've learned about the true experience of living with dementia
Mm.
by surrounding myself and listening to the situations and the stories of those impacted by dementia. So, in my role, I try to understand the experience of dementia from the perspective of those who are impacted, as well as their care partners. And through those lessons learned, I've tried to pass on information that I think is most relevant and helpful to those who are impacted today. These diseases sound devastating, but there are ways that people have found to live alongside these diseases in a way that doesn't derail their overall well-being, but in a way that can preserve it. So in the multitude of things that I do, I think that's the most important.
So tell me about the book and what's revised in it regarding these topics that we're talking about regarding lifestyle choices and caregiving.
Yeah, so I think it's great to have a new revised book come out because the field of Alzheimer's disease and related dementias has really had a lot of forward movement, I would say, in the last 5 years since the last book came out. And I think in a couple of significant ways. And one is that we've really begun to understand this disease and what's happening in the brains of individuals who have the pathology for something like Alzheimer's disease decades before they have symptoms. So, in the past, our understanding and diagnosing of these diseases usually occurs because somebody goes into the office and is complaining of some kind of oftentimes memory-based symptoms. And while that's still going to be the way that is going to contribute to us diagnosing, what we now can do through the help of imaging and something referred to as biomarkers is our scientists and our doctors now have the opportunity to begin to see the disease in the brains of individuals decades, probably 20 years or more, before they're going to start to have memory problems and other related symptoms. And this is pretty significant and pivotal because part of the reason we may not have been able to land on really good treatments for this disease may be and probably is because the disease is so far progressed by the time somebody is sitting in their doctor's office presenting with symptoms. So, at least right now in research, we could image the brain of somebody and see whether or not the pathology, these plaques and tangles, are present in the brain because that's likely going to be where we'll see more beneficial treatments, right? Giving people a treatment before symptoms occur
Mm-hmm.
uh, is going to be and is leading to I think big breakthroughs and how ultimately we will be able to treat, maybe not stop the progression of the disease altogether, but maybe we can treat the disease so that even though the pathology may be present in the brain, it may not get so far down the road as to actually have people presenting with the kinds of symptoms that you and I see
Mm-hmm.
in individuals impacted by dementia. So the book's going to go out, and I think the book will do a really nice job of beginning to help people understand why this is so significant. In addition to that, it will talk about some of the new therapies that are currently available that were not available 5 years ago. There are
Wow.
therapies in a category called anti-amyloid treatment, and they are treating and actually getting rid of one of the culprits of Alzheimer's disease, which is amyloid. So again, 5 years ago, this treatment was not available. today, it may be and often is available to individuals. We believe it can be done safely. It's not a home run, though. I mean, this is not going to reverse the disease. It may not even stop the progression of the disease, but it's a pretty significant treatment in likely for many people having the potential to truly slow down how fast the disease progresses. We think that's important. It's a really important step that we have that we weren't able to talk about 5 years ago.
Hmm.
The other thing I think you'll see in the book is there is much more about our understanding of who is at risk for Alzheimer's disease and related dementias, and helps to ultimately get at, Jay, I think one of the most common questions that I get asked, and that question is, can I prevent dementia?
Hmm.
Or what can I do to prevent dementia? And we may come back and chat a little bit more about that. And then the third thing that I would say that the book does is it lays out a roadmap or a path as best as we can to assist those individuals who they themselves were diagnosed or their family member or friend were diagnosed. And living alongside these diseases in a way that preserves your own well being, in a way that doesn't derail you down a path of darkness, which I think it can sometimes feel like for people, especially when they're first diagnosed.
Hmm.
But once you begin to understand a bit about what you can do to preserve your own well being, um, what you can do to leverage and pay attention to the parts of your brain and your functioning that aren't as impacted. The thing is with dementia, we tend to focus on what's wrong and where the changes are and where the deficits are. And that makes sense, right? Because something has gone wrong. And so many people have spent months going to the doctor and going through testing to figure out what
Hmm.
is wrong with them. And then our focus is so narrowly into this area of what's wrong that we can forget about the fact that we have tens of thousands of millions of neurons, some of them impacted by these diseases, and
Hmm.
some of them not so much. So I think the book really helps people figure out how can I focus on my strengths, my abilities, and what's preserved, and do some workarounds in those parts of the brain that aren't working so well.
You mentioned prevention and perhaps slowing symptoms, not just through treatments, but perhaps through lifestyle factors.
Hmm.
Tell me a little bit more about that. If I mean the listeners of this audience of this podcast tend to be in fitness, healthcare, well-being, that kind of thing, typically with people 50 and over, and I think there's a growing awareness among them that how you eat, sleep, drink, exercise, manage your stress, all these things have a role to play in your brain health. Can you tell me a little bit about that and how it fits into this idea of I don't want to say prevention because I know it's not as simple as do this and you'll never get Alzheimer's disease. It's not what I mean to suggest, but tell us a little bit about that if it's relevant to the book about these
Yeah.
lifestyle changes that people can adopt.
Yeah, I think this is a great conversation to have right now too. For so long we've been talking about the importance, of lifestyle changes for brain health. This isn't a new topic per se, but I think what's new is that over the last 5, 6 years, and even just over the last 6 months, we're beginning to see more data that's supporting this idea. It's not just a good idea we think.
Mm-hmm.
Uh, we're really able to put some data to that idea and show that there is evidence that lifestyle makes a difference. And I like something else you said, Jay. It's likely not one thing. We're not going after, just dissecting, well, is it diet or is it sleep, or it likely is the combination of all of that. Some we may weigh a little bit more heavy than others in terms of the data we have to support it. And I'll kind of give you an idea of what might, if you were to only focus on a few things, what they might be. So I love the fact that we don't just get to have a conversation about what we think is good for your brain when it comes to lifestyle. I think we now have more evidence to say we're pretty sure that these things contribute to good brain health. Before I talk about what some of those things are, I do want to just mention that the number one risk factor for dementia will not surprise you, right? And you probably know what it is, right, Jay?
Oh, now you're putting me on the
I'm
spot.
putting you on the spot.
It's genetics.
Well, that's another risk factor for sure. But the number one risk factor is age.
Well, okay. I
Of
thought that
course,
was,
right?
yeah, yeah, yeah.
Say that, people are like, yep, of course. So I think that's probably why your audience as well, right, is interested in this topic because
Yeah.
as we get into our, late 50s and 60s and 70s, we're beginning to get worried because we know that, more and more perhaps of our peers are having these kinds of struggles and getting diagnosed. Genetics is number two. But I think what we've really begun to learn about genetics, especially for the typical later onset dementia that might happen in somebody's, late 70s, early 80s, that genes may play a role, but what probably plays more of a role is one's lifestyle. And back in 2024, there was a report that was out by the Lancet Commission on Dementia and Prevention. And what this report did is it helped us to understand more of what these modifiable risk factors are. And so there's actually 14 of them that the Lancet report outlined. These are lifestyle risk factors that are correlated with different points in our life. So their report was called the life risk profile, might something like that. But what it showed was there are certain things we do when we're young that impact the overall health of our brain, and certain things we do more in middle age, and certain things that we can do later in life that impact the health of our brain. So, for example, when we're young-ish, there is an association between the amount of education that we receive
Mhm.
and the impact that it might have on preventing dementia. And then when we get into our mid years, it may be things like whether or not we're smoking and our diet and risk for diabetes, et cetera. And then when we get into the later stages, there may be some other things that play a role. For example, managing blood pressure is big, both middle and later stages in life. Treating hearing loss, treating vision loss. We now know that untreated vision and hearing loss can increase risk for dementia. And also later in life, social isolation. We tend to sometimes, as we get older, we may find that our sphere, our number of friends begins to decline for a variety of reasons. And we can have a tendency as we get older to not go out and look for new friendships and to spend more time alone. And oftentimes we're not in a situation where we're working. And so replacing those natural ways that we've had relationships um, seems to, according to the data, have a big impact in the overall health of our brain. So in 2024, the Lancet Commission on Dementia put out these 14 modifiable risk factors for people to pay attention to. And then just a few weeks ago, the Alzheimer's Association, in their international conference that took place in Toronto, Canada, shared the results of a major study called the Pointer Study. And the Pointer Study, like the Lancet study, was looking at the overall contribution of lifestyle to one's brain health. And so this was a 2-year clinical trial, and it found that engaging in a few things simultaneously had a protective effect to the brain. And these few, 3 or 4 things, I think it was 4 things. I'm just going to read from my notes here so I make sure that I get them right. They found that regular physical activity, probably not a surprise to you and your audience, Jay,
Right.
a brain healthy diet.
Mm-hmm.
3 was cognitive and social engagement.
Mm-hmm.
And 4 was health monitoring. And by that, I mean just going to your doctor for regular physical checkups to make sure everything looks okay. That if individuals do these 4 things kind of at the same time as part of their overall everyday lifestyle, they can improve the function of their brain as they grow older. So it really did the same thing or shared the same thing that the Lancet study did, but I think it
Yeah.
helped us drill down even further what
Right.
those maybe most impactful things are.
Hey, are you a fitness professional trying to grow your business with people over 50? If you are, then you need to know how to communicate with them, how to market to them, and how to get them to trust you with their fitness, well being, and money. We're talking about millions of people who are a little older than the typical market that the fitness industry usually pursues. They have more money, more time, and better motivation to make the best long term fitness consumers you'll find anywhere. If you're not focusing on them, you should be. Prime Fit Content is the only content marketing company designed specifically to help you engage people in this group and to help you distinguish yourself from competitors in your community. It's effective, affordable, and super easy to use. Check it out at primefitcontent.com. That's prime, like prime of your life, fitcontent.com. Back to the show. I read about the Toronto study a couple of weeks ago, and I shared it with my readers, and it seemed to be more, not different, but more, right? Is that a fair way to put it?
Mhm.
How much more do we need? And I guess what I mean when I mean we, I'm not talking about the medical establishment like the Mayo Clinic. I guess I'm talking about, I don't know, us ordinary folks out here. When do we start getting the message that there's more to it than just being a sitting duck? You know, that we can help our parents and our grandparents and ourselves by adopting better habits.
Mhm.
Maybe that's not a question we're going to answer today, but it's the kind of thing we talk a lot about in fitness over for people over 50. It's not just about going to the gym and lifting weights. It's about maintaining social contacts. It's about getting out of the house. It's about getting your heart rate up and managing your blood pressure and encouraging people to get their eyes checked and go to the dentist and all of these things that can really fall off later in life. Or maybe when they fall off and you're 30, you don't really notice, or you bounce back, or you just get your
Mhm.
teeth checked next time, or what have you. But they're more important in the overall picture. So I guess I'm wondering what you can tell me. What can I do to help gym owners and people in this consumer-facing, hands-on business reach out to people and help them connect going to the gym and lifting weights to protecting their brain health
Mhm. Mhm.
without
Yeah,
without
well,
being silly about it. I don't want to suggest that, oh, go to the gym and you'll be fine. That's not it. But there is something really valuable here that I don't think is getting out to people.
yeah, I mean, I think, for so long, sometimes it just feels like, I remember so often looking at these studies and year after year, it kind of said, well, it looks like, it's really good to just the studies showed that exercise is good for you. The next study showed that exercise, we've heard that message that I'm just wondering if we've just become, a little bit immune to it
Yeah.
because how many more studies do we need to do to prove that physical activity actually is a really big deal in our overall health and well-being? And but I think we're in a different place. Because I think the evidence we have around how physical activity and social engagement and good diet actually does play a role in the day-to-day operations of how well our brain is functioning. And if we're trying to convince people now, I think we have more evidence than ever before. So if people really want to read, and there's always, the science around lifestyle is never perfect science, right? So we also have to health consumers, and especially those who are really savvy in the research space, it's not like a clinical trial where you give one group a pill and you give the other group a placebo, and you can clearly see the differences. Oftentimes, when it comes to lifestyle, many times we're asking people to tell us, to self-report, what they're doing and what they're eating. So we know that there's a little bit of messiness in the data. But I think what we really look for in lifestyle-based data is, well, what are the trends? Are we seeing that there are some things, self-reported or not, that seem to land some people in the good brain health category and others not so much? And that's where I think we're at right now. I think we can say with more confidence and certainty that doing these things will impact the overall health of your brain. Now, I'm also going to say something because I'm guessing some of your readers or listeners are also going to be they themselves, or maybe they know somebody who does everything right,
Yeah.
who's like, I've been going to the gym forever and I eat a Mediterranean diet and I'm, engaged and have people around me and have dinner with, my family and my grandchildren. And yet, look at me, I just received a diagnosis of Alzheimer's disease.
Yeah.
So this isn't foolproof. But I'm going to share an example that I hope will be meaningful to the listeners here. I was chatting with this couple a couple of years ago, and the wife was recently diagnosed with Alzheimer's disease. And I was talking about all the things that they can be doing for the betterment of their brain. And they came up to me afterwards, and they were annoyed and frustrated. And they said to me, "Hey, listen." So my wife, this is what the gentleman said, and she said this about herself. She said, I got diagnosed with Alzheimer's disease, but I am a professor at a liberal arts college and I teach 7 languages. She was an amateur tennis player. Even though she lives in Minnesota, they have a year-round greenhouse where they can grow their own organic vegetables. They traveled the world. Her husband was a marathon runner, also a professor at the college. So they were just saying, we should not be here. Everything you've said, I should not be here. And so my question to them was, well, can I ask you how old you are? And they were both in their early 90s. And I know this isn't always the case, but my comment to them was, I am pretty sure your diagnosis could have occurred 10 or 15 years earlier had you not been living the kind of lifestyle that you had. Now, that doesn't necessarily explain why somebody who has a really great brain healthy lifestyle gets a diagnosis in their 60s. I think in those situations, we probably are faring a little bit more on what's going on genetically that may have had them predispositioned to have this disease earlier than most. But
Mm.
I think if we're living a brain healthy lifestyle, there's a really good chance that we may push back the point at which we start to have symptoms. It may not mean that we'll never get dementia, but
Hmm.
it may mean instead of having symptoms at the age of 75, we're having it at 80 or 85.
Hmm.
And
Yeah.
that is better than any medication we have available right now. Even the new anti-amyloid treatments that are now available will not delay the progression of symptoms as much, I do not believe, as the kind of lifestyle factors that we're talking about today, Jay.
That's profound. And I want to be respectful of your time and wrap this up by asking you to describe for me the recipe for resilience because the message to caregivers is super important. And I love the way you put it with the recipe. What do caregivers need to be doing to take care of themselves? And how can they get over the I mean, I'm guessing there might be some guilt associated with self-care. How can I take care of myself? I've got to take care of my husband or my wife or parent or what have you.
Yeah, I love that. Guilt with self-care is a real thing. And in
Yeah.
fact, if I were to describe to you the 2 emotions that I think are often talked about and most prevalent in dementia caregivers, it's guilt and grief. That
Mm,
those two are truly heightened. So the book outlines this a bit more, but let me just go through the sort of the four things that I think are key. And the first one is acceptance. And when I talk about acceptance, I'm not talking about as a caregiver that you're agreeing with or liking the situation or giving in or giving up. What I'm talking about with acceptance means that you've transitioned from this place of a little bit of denial, which, by the way, is a very effective coping strategy for us in difficult times, to truly seeing things as they are. I had a family say to me a few months ago, we had to stop dwelling on the way our mom used to be and be fully present for who she is today. That's a great example of what
Mhm.
acceptance sounds like, letting go of who they used to be and being fully present in all the heartache as well as the beauty that can be before you. So, acceptance is transformative. Acceptance means being honest about what you can and cannot control. Acceptance means believing that good enough is good enough. The second thing that I would say is in that recipe we spoke about already, and that is caregivers will feel grief. Caregivers feel grief. And it's important for caregivers to actually acknowledge and feel their grief versus push it aside or suppress it. Grief cannot be ignored, nor can sadness or guilt or any other tough emotion. There's a saying out there that goes, what we resist persists.
Mhm.
And in order to transform difficult feelings, we first have to acknowledge them. We have to give them space to breathe. And so helping caregivers find a way to live alongside their grief, I think is the next step to a recipe to resilience. The third is that caregivers need to find new ways of communicating. And we could have a whole conversation on this, Jay. So I'm just going to sort of plant the seed that oftentimes, especially with couples who've been married a long time, they have acclimated into patterns of communicating that have worked for them over the years. And now we have dementia and some cognitive changes really upsetting that. So finding new ways to reframe and to be in communication is a skills that caregivers can learn and can
Mhm.
actually play a significant role in preserving the relationship. And the fourth thing in finding that in that recipe, I would say, is that caregivers need to find their people. No caregiver can do this alone. I'm going to repeat that. No caregiver can do this alone in a way where they can preserve their well being along the way. Whether that's a good friend, whether it's a neighbor, whether it's somebody at church, whether it's participating in a support group, we need to find one another to validate this experience, not to necessarily fix problems that can't be fixed, but to validate the heartache and the difficulty that caregivers are experiencing. They need to be validated with one another. They need to know they're not alone. Those are the four things that I think are that roadmap and that recipe for caregiver well-being.
Thank you. Thank you. It's very helpful. And this has all been illuminating. And I want to thank you and your colleagues for working on this book. And thank you for making the time to talk to us today.
Thank you so much for having me, Jay.
Have a great day.
Thank you.